to reduce the backlog of cleft lip and palate surgeries in Gauteng. Operation Smile and the Nelson Mandela Children's Hospital, with support from Life Healthcare, will deliver an intensive surgical program from today until Sunday. An estimated 40 children are expected to benefit from these surgeries. Newzroom Afrika's Zola Sholwana is following this story for us and joins us now live. And I'm sure you as well, Zola, will be breathing a sigh of relief at doing a good news story on a Friday afternoon. And what a great story this is for the 40 children who will be helped through this initiative.
Well, yes, indeed, Michelle, it is a beautiful story, a feel-good story for a Friday, especially when you are here at the Nelson Mandela Children's Hospital, where you get to see these children who probably are not even aware of their condition, and parents who are thinking about how their children would possibly grow up if they do not, undergo the surgery that will be happening here at the hospital. We've spoken to some of the one of the patients really who went through this, this surgery. Unfortunately, he did it quite at an older age, at 19, where he told us about bullying and how he was, felt like he was not part of the community, couldn't even take pictures of himself, but after this procedure, he now is able to, smile confidently and also take pictures and let people see him. So he was here to tell parents of those children not to worry about the process. Their children will be well. But let's speak about, let's speak to the CEO of, Life Healthcare about their involvement in this great initiative. So thank you very much for your time. We have seen how heartwarming this is. You and I just spoke about it now. What's your involvement here as Life Healthcare?
It's a unique moment for Life Healthcare to make a significant contribution to what you can see is the epitome of public-private partnership in action. And our participation here is not only financial, and as we'll discuss a little bit later, is also about the contribution of resources that will literally make life better for lots of patients.
Mm-hmm. Let's also speak about how this initiative is helping in addressing the shortage of specialized skills in surgeons.
Well, as you can see in the way that you've looked through the pathways that have been created here, it's not just about delivering care to the children. It's also about making sure that the training is taking place at the same time. If it's not in the nursing categories, the anaesthetists, the surgeons, the dentists, the speech therapists, each one of them, and I've spoken to them today, has said part of their job is to make sure that they're training the next generation of specialists and clinicians so that they're also able to continue this great work. So we think that that's part of how you make this not only heartwarming today, as you said, but sustainable as well.
Mm-hmm. And something that I picked up from walking in those corridors are doctors and nurses that have taken part in this initiative. And many of them have basically donated their most precious resource, which is time. How do you feel about that?
I'm incredibly proud. It's one thing for corporate to put financial backing and support to an enterprise such as this. It's another where your staff volunteer. No one asked them to do it. It was their idea. They wanted to do it, and they do it selflessly. They don't get reimbursed for it. They use their annual leave to actually participate. And one looks at it and it can only make you feel proud as to be part of a team where you have people in your midst that are prepared to make such significant contributions.
Mm-hmm. So moving forward, what do you think government can do to ensure that, these kind of partnerships yield the results that we are seeing here today? Because if 40 children can undergo a surgery, and this happens probably 3 times a year, meaning that it can actually reduce the backlog of children that have such conditions and are unable to be seen by surgeons.
Life Healthcare for many years now has made heartfelt pleas for more partnership and more cooperation between the public and the private sectors. Here we see in front of our eyes exactly what can happen, where collaboration and the spirit of partnership between the private enterprise, Life Healthcare, the Nelson Mandela Children's Hospital, which you see is a world-class facility, private citizens, doctors, clinicians, nurses, and the public sector patients all come together in a process that delivers, as you said, heartwarming smiles and happiness. It's got to be something we have to do more of. South Africa needs it. And at Life Healthcare, together with the support from our board, this is what we want to see more of happen. We have to do it. It's the right thing to do.
Now, Peter, what's the criteria that's looked at in terms of selecting the children that will undergo the surgery? As we understand that about 40 of them will be seen by surgeons.
And therein is the difficult question. Operation Smile, through many countries throughout the world, have established a set of criteria where they feel that within the parameters, the clinical parameters within which they can deliver the care, they have set out those boundaries as to which children will qualify for the specific surgeries that are taking place tomorrow. As a human and from a life healthcare perspective, you'd want all of them to be selected, but they have to be careful clinically that the conditions that are operable within the safe surgery protocols that have been established are adhered to. But as to the clinical aspects, you'll need to ask the doctor.
Thank you very much, Peter, for your time. And that is the CEO of Life Healthcare. And they've partnered with Operation Smile in this great initiative that is meant to change lives of many. We do understand that about 40 children will be seen by different medical experts, and some of them might not be able to undergo surgery. We actually spoke to one of the doctors that said there are factors that contribute to that. If a child is too tiny or they have a medical condition that perhaps possibly prohibits them to undergo surgery at this particular moment. But we'll keep you updated, as we will also be speaking to the CEO of the Nelson Mandela Children's Hospital. Back to you in studio.